Thank you. Good afternoon, everybody, all the people who are watching my webinar. I would like to welcome all of you, very warmly welcome to you all to the live webinar on the review of management of diabetes and cardiovascular diseases in COVID-19 pandemic. Actually, initially, the discussion intended for the core group of doctors, around 60 people who used to travel with me every year abroad. And then I used to give them lecture over there. But because of this COVID-19 pandemic this year, we all cannot go. Unfortunately, we all cannot go abroad, so we cannot enjoy our foreign trip. But Mega Life Science, they still want to maintain their academic activities. So instead of going abroad, we all need to stay at home, and then at the same time, they want to hold a webinar. So with that background, this webinar was organized by the Mega Life Science. And although we intended for the core group who used to travel with me, but this is for the academic activity for all the doctors. We invite all those who are interested in the topic. So this is for every medical doctors. So with that introduction, I would like to start. Well, the aim of my presentation is to review the management of diabetes and cardiovascular diseases in the COVID-19 pandemic. As we all know, we have an unprecedented pandemic starting from the early this year, which started from Wuhan, from China, and then spread all over the world. And that COVID pandemic have changed our life. Although we started with only a few knowledge on the virus and the disease itself, because of the extensive studies all over the world, new knowledge has been added. Its new knowledge has been coming almost every week, almost every day. So with that evolving knowledge of the COVID, I would like to discuss the management. And various professional associations all over the world has been making a recommendation for the management of COVID and the diabetes and cardiovascular management in COVID-19 pandemic. And I would like to review all the salient features of the available recommendations. And in this presentation, I would like to start with how common is diabetes and cardiovascular diseases in the COVID patient. I would like to start with the one meta-analysis from the 12 study data from the China, which has in conclusion mentioned that diabetes may not increase the risk of SARS CoV-2 infection, but it can worsen the outcome of this new virus diseases. And to support the fact, the finding was in this shown in this forest plot diagram, where you can see all combined 12 studies and the incidence of prevalence of diabetes among the COVID people. And you can see there is a finding heterogeneous, not heterogeneous, but in combined all 12 study, the overall prevalence was not more than 1, which means that overall prevalence of diabetes, prevalence of COVID infection among the diabetes population was not found to be more increased. It is more increased than the non-diabetic patient. That is the first salient features. And second thing is that although it is not more common, diabetic patients are more prone to develop diabetes, But once they have a COVID infection, they found that more severe cases occur in diabetic patients. So diabetes COVID-19 COVID-19 and they have a more chance of developing severe disease and mortality. And in this plot, in this forest diagram, out of 12, six studies were combined to analyze the data, and they found that being diabetic, they have a 2.2 times higher to be in the ICU than the non-ICU patient. So COVID-19, diabetic patient, they will develop a more severe infection and land up in the ICU. And the first study, that was the initial. And the first report on the large group of diabetes, like large group of COVID-19, more than 40,000. First report, it came out. It is the report of the World Health Organization and the WHO and China Joint Mission study on the COVID-19 that was conducted in February 2020. And they found that highest risk of severe disease with the high mortality was found in people aged over 60 years and those with underlying conditions such as hypertension, diabetes, cardiovascular diseases, chronic respiratory diseases, and the cancer. And the case, they also found that out of 100 COVID patients, only 80% they developed only mild to moderate, which means that they were either pneumonia, mild, or they're non-pneumonia. And the severe, 13.8%, who will develop dyspnea, respiratory rate more than 30 per minute, and PaO2 less than 93%. And on chest X-ray, there will be more than 50% of the lung will be infiltrated with some shadows, and within 24 to 48 hours of the infection. And only 6.1% of those people out of 40,000 COVID patients, only 6.1%, they actually develop respiratory failure, septic shock, multi-organ dysfunction, or failure. And the overall crude fatality ratio, CFR, was found to be 3.8%. So, well, crude fatality ratio can be very, it depends on the denominator, number of patients and the number of patient die and the patient with COVID. COVID patient is denominator the mortality rate but according to the report, it was found that CFR was 3.8%, out of which more than 80 years of patient, 80 patients with more than 80 years of age, they have a CFR of 21.9%, quite high. So that's really put there. And what about men and female? And the men, they have a higher mortality, 4.7% versus 2.8%. Those people with retirees, now you pension directly and no COVID morbidity. No comorbidity, only CFR was only 1.4%. Whereas those with comorbidity, you can see here clearly the cardiovascular disease, CFR is 13.2%, whereas for diabetes it was 9.2%, and for hypertension, patient with hypertension, CFR was 8.4%, and chronic respiratory diseases, more for case fatality rate of 8%, and those people with various forms of cancer, they have a higher fatality rate of 7.6%. That was for the big study, China and the WHO joint mission to finding. Yeah. So which means that cardiovascular diseases, diabetes, any yoga machine, the culture. Again, there are many studies from China and also from Italy and also from US. I don't want to go into detail all of the all of these studies. No, and another big study from United Kingdom, US NHS England study, through two studies, through type 1, type 2 diabetes and COVID mortality in the whole population. And our first study, first study, there was 61 million people registered in that cohort. 61 million she registered. I checked the USA United Kingdom population diabetes type 1 are 0.4% and type 2 are 4%. So Nathan Shitao, a diabetes population cohort. A cohort through study Logire Kajaro. The overall case fatality was 23,000. There are more than 1.5% people with type 1 and 31.4% type 2. When we make an adjustment, case fatality in 100,000 per percent more. Overall, those are share out the type 1 are 1,000 share and type 2 are near Chelsea. Just cheated. Statistically, when we adjusted for the age, sex, deprivation, ethnicity, and geographical region, they found that very interesting. Type 1 people with type 1, they have more fatality rate. They have 3.5 times more chance of dying. And the type 2 people, whereas type 2 people, 2.3, 2 times more chance of dying. And if we include the adjustment, coronary heart disease and cerebrovascular disease, heart failure, then still type 2, type 1 patient die more than 2.8 times more than the general population, and people with type 2, 1.81%. This is a very fast study. The whole population will party. Diabetes cohort, diabetes cohort, first study. They conclude that this nationwide analysis in England demonstrated that all types of diabetes, whether type 1 or type 2, they are independently associated with significant increased rates of in-hospital death. So that's why US, Italy, China finding out severe disease. This study and type 1 diabetes have higher mortality than the general population, and they also have a higher mortality as compared to the type 2 diabetes. So that type 1 and type 2 type 1 this is the very first time. And I think diabetes cohort through UAV study diabetes during the COVID period, mortality that people with diabetes in England have more than double. Non-COVID period is and one interesting finding is that hyperglycemia is a risk factor for the increased severity and the mortality, so also the obesity. We do so in both type 2 or type 1 over, yoga, spiritual, yoga theory. So far, Batu so type 2 diabetes COVID no COVID yoga diabetes COVID so COVID diabetes COVID patient in this time severe the United Kingdom study type 1 type 2 type 1 type 2 general population so type 1 now question why is type 1 usually the explanation type 1 duration duration of disease yoga now type 1 is generally so insulin dependent. Another type 2 in a sign to control a take your account more hope. No, era down at the not quite all. The prevalence of and the impact of cardiovascular metabolic diseases in COVID. Now, China, another meta-analysis to Chile to see, no, patients with previous cardiovascular diseases may face a greater risk of developing into severe condition, and comorbidity can also greatly affect the prognosis of COVID-19. So, diabetes comorbidity. If we look at this plot diagram, forest plot diagram, hypertension as far as diabetes, hypertension is concerned, those with diabetes, those with hypertension, spontaneous means transition. They have a prevalence rate of 17.1%. Hypertension share among the COVID 17.1% prevalence here, and non-ICU and ICU patient, they have a 2 times more chance to get into the ICU. And cardiovascular, cardio and cerebrovascular diseases, then 16.4% mortality, 4% among the COVID patients to there, and then if they have cerebrovascular disease, cardiovascular disease, they have 3 times more chance of getting severe disease, so that they are going to be managed in the ICU. So hypertension, CVD, and the diabetes. Diabetes are among the study population. Prevalence are 9.7% to there, 9.7% to there, and the having a diabetes, they have 2.2 times more chance of getting severe diseases, going to the ICU, requiring the ICU treatment to it. So the diabetes diabetes so now finally who are the cardiac COVID treated Lurima, Eddie Lurima, Pubiro heart damage, Pubiyara to the air. So, da a good treatment, no COVID-19 patient in turn aggravate the damage to the heart. The heart go to the damage to the amulet, China to the air. So, these are the no, it is moving, not touching the wheel. So pathogenesis are roughly joined or general SARS COV, SARS COV virus, better than some use no? Better than you some to a jar on the machine, and pangolin to the thing with yellow account you, Chimel use what do you see to out there? Do must have droplet infection at Tore change out into the general transmission. General arm knock up loss is 2.3 loss sheet, 2.3 to 3.5 loss sheet. Neogani, but not a Teoka, good one in this raw. Era Patma Napa Dodema, General Tapa Dodema, Lisa Gua, Teogani, Lisa Gua, Salia Solution, General Society of the Gua, what a collective yard have you. I treated to them, diabetes treated to the Pani, no? Era once the diabetes patient have COVID, they have more chance of developing hyperinflammatory states and a muddy organ failure. Muddy organ failure, see. Pilu, the yoga pusure, elusure. Tara alutijare, the Polancarana to Jalime, the pathogenesis start with the SARS virus attached to the ACE2 receptor over the cell membrane. Aima, to even that to test associated TMR, TMPR, SS2 or transmembrane protein, serine 2 receptor. The Nakua Pona Bureau, to endocytosis at a Wundara, Poviro, Miandwara. Miandwabiro virus RNA, the single stranded positive RNA, intracellular cytoplasm, viral, the replication if you're there. Now, replication if you're there. Now, virus protein, polyproteins, polymerase enzyme, pala protein, so spike protein, membrane protein, E protein, that is synthesis, the receptor, jare, lemma sheet, nucleus machine, single stranded RNA, that is synthesis, and the alo endoplasmic reticulum, piamiro, yalgavido, piamiro, assemble low like it, piamiro, various party, piamiro, low like Golgi complex, piamiro, colon, no, finally, look at SARS COV, the government lavia, Napai, a common other piano. This is a very rough explanation about the virus replication inside endocytosis, replication inside the cytoplasm, and the exocytosis. Along this process, in the cytoplasm as well as outside the cytoplasm, because the virus is over there, inflammatory, macrophage, neutrophils, adaptive immune mechanism, stimulate after 10 to 70, adaptive immunity, stimulate. And I jamlu, Napan pathogenesis of Chilare. Membrane, if we have H2, it can, virus can attach and go into the cell with the aids of TMPRSS2, transmembrane protein, serine2, no? If the membrane has the expression of the ADAMS17, that's receptors, they detach the receptor, H receptor from the membrane and through a serine, which means the expression of the receptor over the membrane would be there is less chance of virus to come to attach to the membrane. So ADAMS17 the virus at no? ACE2 virus at once the virus inside the cell, primarily, although it is a respiratory disease, respiratory infection, actually it does not confine only to the respiratory tract, but also it spread to the heart muscles and the vessels and gastrointestinal tract and the pancreas as well, because these organs are also, they can have an expression of the ACE2 receptor. Inside the lung, for example, once the virus go down to the alveoli, type 2 pneumocytes, surfactants, no, chemical to type 2 receptors, lungs, macrophage, T cells, and cytokine, no, there will be very heavy discussion. Macrophage cytokines, T cells and cytokines, that will lead to the cytokine storm that is responsible for the multi-organ failure, no, enhanced inflammatory response. The culprit, the main responsible interleukins are interleukin 6, interleukin 7, interleukin 22, IL-22, and CXCL10. The agent is cytokines, multi-organ damage. Respiratory heart muscle damage, no? Myocarditis myocardial damage, eventually patient can develop myocarditis and then heart failure. COVID-19 patient, no, cardiac marker, cardiac enzyme, trop IO, no, to be high sensitivity, trop IO, this is the indicator that the virus has attacked the muscle, no, affected the muscle of the heart. Patient can have a heart failure as well as the cardiac arrhythmia. On the other hand, because of the binding of the COVID in the endothelium cell of the small vessel, microvascular circulation, or the macrovascular circulation, they can also develop dysfunction of the cardiac function, leading to the acute coronary syndrome. And one point of noteworthy is that because of these cytokines and the pro-inflammatory response, the arteries, not only coronary artery, but also the pulmonary and the cerebral, and also in the lymph vessels, they can have more chance of clot development. in the coronary artery. Because of that clot formation, they can lead to the development of the coronary artery syndrome. And when we look at when we compare the inflammatory response of COVID of diabetic patient and a non-diabetic patient, we found that diabetic patient, they have a higher C-regulated protein and a higher interleukin-6 level in their blood. And another study from China also found that COVID patient with diabetic patient, non-diabetes and diabetic patient, they have a higher alpha-hydroxybutyrate dehydrogenase, alanine aminotransferase, lactate dehydrogenase, gamma-glutarate, transaminase, transferase. So, anti-C-reactive protein through inflammatory markers here, diabetic patient. But on the other hand, diabetic patients, they have a lower protein level, pre-albumin level, albumin level. So which means that patients, they can have some malnutrition or protein malnutrition through or this here conclude. And this is the overall response. Response are all. Virus response, once the virus go inside, the first phase is the viral replication or viral response phase. During that period, there will be only mild constitutional symptom. Temperature will be just slightly high, 99.6, and there will be dry cough, diarrhea, headache. And as a clinical sign, there can be lymphopenia, increased prothrombin, increased D-dimer and LDH in the stage 1 stages. If the disease progress, the pulmonary phase go into pulmonary stage. Lungs are getting involved. In that phase, the patient will develop shortness of breath, and there will be hypoxia. And the chest imaging will show more infiltrates, either in chest X-ray or in the CT. There will be more infiltrates. And as the disease progresses, that stage, because of the augmented host inflammatory response, all the multi organs are affected and damaged eventually, leading to the acute respiratory distress syndrome, and the multi-organ involvement, and the shock and the cardiac failure. And in that case, elevated inflammatory markers, CRP, LDH, interleukin-6, D-dimer, protein, troponin, I, and the pro-NBPN, that is remdesivir that now approved for the severe COVID-19. Remdesivir actually the virus when it changes effective now chloroquine, hydroxychloroquine, so those no later was severe change now convalescent plasma should be administered in the early phase, and the immunosuppressive also should be started in the early phase. Like later, the inflammatory change effective. As far as diabetes is concerned, main defect is in the T-cell regulatory. T-cell regulatory T-cell lipocytokines regulation impaired not pro-inflammatory regulation below network, high pro-inflammatory markers CD4 TH1 T helper cells one to stimulate now CD8 expression T cell and cytokines dysregulation of the glucose level, blood glucose. Not who are pancreas beta cell, not the exocrine, endocrine cells, beta cells. There's an expression of the CV of the ACE2 receptor where the virus can come and attach and damage the beta cell. That will also lead to the hyperglycemia. That is interesting. So, in addition to the inflammation, and in addition to the tissue injury related enzymes, No? And in addition to the hypercoagulability stage for the diabetes patient, they have another mechanism, which is thought to be direct effect of virus over the beta cell. But studies through immunostaining of the patients to die from the severe COVID, there are expression of ACE2 receptors in the beta cells. Endocrine beta cells, beta cells direct attached to the use. Not COVID-19 diabetes patient early stage the high level of biomarkers is there. No, initially all the signs and symptoms may be hidden. This is very important. When we compare non-diabetes and diabetes patient among the COVID patient, diabetes patient they have a less chance of developing fever, chest tightness, and shortness of breath. No, you can see this comparison as compared to the non-diabetic COVID patient, which means that early phase misleading we depend on the signs symptoms. The silent symptoms they can lead to the life-threatening delay in providing the needed care. Asabama yoga machine would treatment through sort of so what actually it is very crucial not to underestimate the COVID-19 severity patient in diabetes. No symptoms you were or scream local advice to Taiwan. Diabetes patient she get to see early phase diabetes machine due to science fever, cough, respiratory distress to a chitin nuna pumine. Later Jada to a severe the lower treatment Miyare Kajaro, show me to let a Kajaro, Nabanjaro, Yoga Pupita Nuna, Pubiro, Miarao, Tuliman. Diabetes patient in Ma, Tujara Kua, no, you know insulin luria, Pubi insulin lula. 29.2% they will require more 29.2% who has already have insulin before their COVID. COVID to that change through a poor insulin requirement in Miala. And 37.5% of patients they have only OAD or oral glycemic agent. They will require insulin. So not quite. Among the ill patient insulin deficiency fit the lab. So many patients requiring markedly insulin infusion. Insulin dose are subcutaneous infusion rate 30 to 40 units per hour. Very high dose. There's the infection, inflammation, insulin resistance, degree of glucotoxicity is profound and it is independent of the pre-admission diabetes control. Diabetes diabetes control account HbA1c count COVID-19 sort of severe disease check non-decay, euglycemic decay now to new onset diabetes this is the finding. Now conclusion. Glycemic status can get worse during the COVID-19, regardless of the pre-admission glycemic status. No, insulin requirement during the COVID infection requirement are so high, getting higher. Now, infusion in PRT, infusion in very high doses of PRT, insulin requirement is tap on. And people with OAD also began insulin required, insulin required patient. And the pre-diabetes and asymptomatic patient, they can also develop new onset diabetes control. And some people, without having developed diabetes, they can still develop stress hyperglycemia. There can be 5 modes of presentation as far as diabetes is concerned. What about the management? Management in it are various professional bodies. Several bodies has recommended the various recommendation. We need to step up management of diabetes. It is essential. We need to step up the management. Strict control, this is the first and foremost requirement. And this report, timely blood glucose management for the outbreak of COVID-19, this is urgently needed. So timely management, this is first point. Second point is patient-tailored therapeutic strategy. Patient-guided therapeutic strategy, we need to achieve optimal glucose control, and we should also take into consideration of the severity of disease, presence of comorbidity, and diabetes-related complication, age, and other factors. So this is the second requirement. And the third requirement are a multidisciplinating team approach is very important. Infectologists, infection specialists, COVID-19, they should also collaborate with endocrinologists. And endocrinologists should also collaborate with the infectious disease specialists and pulmonologists, psychologists, and nutrition specialists, exercise rehabilitation, so on and so forth. So we need to have a multidisciplinary team approach to it. Stress level. This is according to the finding from China, it is finding from America and Italy and the UK. Multidisciplinary approach can only be effective in the management of diabetes. And various professional associations like AACE, American College of Clinical Endocrinology, American Diabetes Association, International Diabetes Federation, Association of the European Society of the Cardiology, and other professional societies like the AACE, etc., Canada, Diabetes UK, Diabetes, and the NICE, they have put forward there are several recommendations. And actually, no specific recommendation for the diabetes during the COVID. I think I try to let you know, sit day management. Name county chamber by lower level. ACE same referral. Lunaria, penny shopping, Mipian, Genoa, and then Talazaro, she will do the Genole, Pamayuma subject of your work. The real recommendation, Talata, 30-day stores of not only the medication, but also for the diagnostic stocks like a glucometer, strip, lancet, Taribashi will do that. Another 1 month. And stay home according to the locality. Stay at home to look at stay at home as much as possible. People look at it, and then wash hand there, and the cover nose. This is also very important, and avoid touching the T-zone. T-zone them yellow naku nakam pazabo. The lady that is yellow no, and Bechima Siam Nepiame, Bechima Siam set them fever, cough, shortness of breath, wheezing, especially if you believe that you may have been exposed to COVID-19, and I tell you, hair caption, Lansabulu. Lansab you, Lansab your hair caption, Lavalu your mouth, that droning him over. Janoshima Garo, that ship is in a Lunasiam direct Laroma. No, our Janoshima telecommunication by Nalate, one should walk. Take you off, but don't jar. I'll say when you let me tell one and Lansab is like Timshi Jaro. Era Kuchano, Agile, telemedicine, Luna, never Peter, Luna go, once we go and Luna, when in Lamido, advise of the achievement, new Norman in the general Lojaro, man. Now live in the or live in or have recently COVID-19, go out and running in the air or sort of Singapian, Singapian, no, a good general India Pianajare, general, a good Urea Pianare. Not quite general Bangladesh Pianare. General, yes, screening, general, Emoja to Didema, class A, B, C, war, ending any Piana, Lunga, Salia, generally are tab your mutant arrow. Anything any method, anything and the American Kune at the Rumida machine, tell me, bro, Lulim, but John Roshimare, Nemura, she, the good Amatau, Kutala, Piana, the Twatu, review yoga Pietara, Kupa Mujima, Kunetu Niretama, Nay Nengaja, Gapianga, the Lazar, tape screen logo, General Lulim. Hello, Share, Chancellor, Erasino, General, SARS COV, Simulure, Dame Genoshima, Dame Pibian, Georgia Piare, Chancellor, Piare, Chancellor, COVID Pinagina, General Sium, Sium and PUI Nema, Pinay, Shilusino, PUI more, patient under investigation more, PUI and Tavido, I do a severity, I say my Sibima, Yami, General Yangosimato, Yangosim, General Webagi, direct General Pulumia, no? A Yangosim, not buying a General Janasium, Tinjai Chuma, General Siloyam, Appearing Marcelomia, Eddie Lulu, the Netherlands Ema, General Salia Tavulume, no? Or the morning and Yabian, General Magulodira, General Facility Quarantine, or Hotema, General Community Quarantine Center, General Tire. A Yichida hydration, hydration, symptomatic treatment, General people, as a child, energetic, no, energetic, antibiotic, General Pilu. Type 1. Type 1 diabetic Pima Sura to a jam, Kidone, General Black Blue, which I'm going to follow, General Type Ludima, we did down in the Ludima, General Yami review the Bulume, we are Navantan of Jabame, say Umaro, Tenedu, insulin is the drug of choice. Insulin go, people, insulin go, by insulin regime, don't mess around, General Tidlato, no say you go through guideline through Yita, not guideline Yita video, I guideline Tomu Lulime, together. COVID Kuni, physician Yadi, the girl physician Yabes, and Naguda Tabelu, no, then it Matemene, Elube, Musa, Venetigo, severe cases, the Maro, diabetologist, endocrinologist in a diabetes control, Gonzalo Viro, Nina Kuino, Pubi Comelu, Tine, no, General Adari, Manari, then they show Viro, no, General Denganaga, Sinami, also, no, and then a diabetologist, endocrinologist, a diabetes management through a time we will do. Another guideline are not through a babulous or is a medication, the diabetes specific nutrition people who are general nutrition Piatana Chibare, Pajan Lesero, A Kalama, general study looked at Chile, no Pavaningama West study looked at Chile, and another published looked at Chile. Humanitarian crisis, Duria, carbohydrate and carbohydrate related Harivasari. Attribute the Hiroshima, Ane, Imani, Ane, Ashigen as we go, a Chui without a Kisa, Madasai without a Kisa, no tutorials of Dasai without a Kisa, attribute Pokari sweat to 100 plus of Siju Mataluya, without a Kisa, not to go Ashianos, we are see you no more so no more Miatan Kisa, Dari European Miro, since I will do no, and I did coffee make it down in the Kisa. Daria Sijuri, a content in the Kisari, then Pian Viro, JJP and since I will be a review local, what not? Or diabetes specific nutrition, so general Dautian people do. Physical distancing, appropriate exercise, adequate sleep for 7 hours. Now, we have frequent monitoring of the blood glucose and de-addiction. So, tobacco smoking, alcohol, and digital detoxification. Screen time with the Nego time, the TV, zero screen time, time your time, you no mobile phone, you were Tangina, you people, no mobile phone, the name and idea was you recommendation job. Now, G. Mema Taku Lubame. And is here ARBD grow, Tizolidine diagnosis, actually duties are generally they should be used with extreme caution. Yapo town interview, Yapo General Babu, no, pharmacovigilance, we should be on our toes to watch out the side effect, no, and the adverse effect. And if the patient hasn't taken it previously, so no, we should avoid starting them fresh. And Shamulu, ACE inhibitors, ARBC, for hypertension, cardiovascular disease management, and Miazua. Is H2 receptor mata bound and pitted to Jamu, Bubio Suna to counting music who should professional societies, cardiac societies, endocrine societies, all over set up and they may even paradoxically protect general based on our experience previously from the influenza and the mass to war through effective in set up sick leave management of Johnny SICK sigma blood glucose level general sound Kanakana tiny volume, Saponin urea, insulin doses, NRU, blood sugar controllable, increasable lume, a mere regulable lumi there, no, and insulin never stop insulin, Jonoshima, Piatana, Hypoyavisunama, throughout. Or oral diabetes medication during this period because they can lead to the decomposition, severe decomposition, DKA, hyperosmolar non-ketotic coma. Hypoyalusin, Shobro Lume, Dubadanya, Loma Japanese review, no? And even during the illness, because of the stress, the patient may also need, may need to have an increased dosage down Lurang Luna. And the ketones is in the diabetes, stress, diabetes, stress, diabetes, stress, insulin, Purama Luna, general insulin regulable. Carbohydrate intake, maintain hydration and carbohydrate intake. Now, Asamasa, general, DK, general, 9 wash it. No, not a ketone, general regular check global. Sick day management to pneumonia general SICK at the sign out general PMB check global. Diabetes management of diabetes, if the glucose control is good, then continue the same anti-diabetes. You know what residence. This is very important. This is very important. But if the control is suboptimal, then intensification with the insulin. Now, so not distress of insulin people. However, taking into consideration the lockdown situation where the access to medication can be the issue, in that case, we need to strictly adhere to the dietary advice for the diabetes, and we might need to up-titrate the available drugs. Seriously, we're no? Insulin is indicated. Now, diabetes patients are usually associated with obesity. Then obesity can be associated with sleep apnea, reduced ventilatory function, suffocant dysfunction. And I GLP-1 is down there, all steady. The government down there, and as you know, before, as before, unless infected by moderate to severe. My cases, no, moderate to severe cases, they might need to be stopped. Same double, they might need to be stopped. And but it is not wise to initiate aggressive weight to the what is the teaching which and avoid restricted diet, keto diet to general fasting no fasting intermittent fasting, prolonged fasting, the COVID calamaro, DK general sick with a tolu lalu no sanija rain savi, DJ Maro, Toaviro, Sasso with a which are general, no, and no sudden change in the pattern of diet or activities, and light or moderate exercise like yoga, or I prefer personally Tai Chi, no, and moderate exercise, no, and this is advice. And be careful, COVID-19 is associated with catabolic stage. As they can lose weight and they can have a increased sarcopenia. Adequate calories very required, adequate intake of proteins required. It is recommended that calorie intake should be 25 to 30 calories per kilogram per day, whereas for protein 1.5 to 2 gram per protein per kilogram per day is recommended. For the ICU or ventilator case, parenteral or enteral indication of sortia sabu, no, blood pressure management it should be continue as usual recommendation. Don't stop ACI or ARP. No, antihypertensive drug has to be initiated. We do no room machine, which I'm at 2 chillers, so you know, any drugs you show in Shambor. I mean, no only without this, you know, ACI ARP just carry on. No, but the Chechen medical sick medical emergency sick local advice to look less when you dog. Local less when you know. No, if they are not sure what to do, but over medical chain, go yoga and battle. And the blood glucose are yamia and the symptoms indicator of the key killer, you know. Yare, and as we do, Sam Lamido, people look valime, Sam will Lamido, a John Jabu. That's sick tree management, a sugar, sort of pure time today. Again, practical recommendation or one recommendation outpatient and inpatient. Outpatient must be standardization of the patient with diabetes for the importance of optimum metabolic control. Now, patient is who the glycemic control are carried around, you know, pure carrot therapy, you know, town just optimization level. Now, premature discontinuation of the established therapy, utilization of the telemedicine, general good telemedicine, by do consult there, no? And I'll pull with a DJ Maro, general, don't now she shall direct with the moment of Chile. Together, see you 10 years, so you know, now monitor new onset diabetes, now, general monitor local lume, diabetes, optimal glycemic control, and then general sometimes. No, inflammatory markers, then biochemical markers, sometimes. A GG or plasma glucose concentration outpatient and 70 to 144 jama tame, the same solution, you know, and 70 to 180 jalati, general talo yare. No, HB1C, you know, then around 7 or 6.57 kilometers. See, Nepathalura, Mepom, Tamashima Tawa, Bamshi, Dame. Dehydration may let it so the China is in Japulume. Otherwise, General Tony Jan said Tabulume. Tame, COVID during illness to renal function, Edo China, Japia. SGA2, no, Bama people Mike is set out, not Dabimelu, General, dehydration she there, decay, the patient utilize to Lujan, no, Edari, General, Lowa, Japia, General respiratory disease. No respiratory distress syndrome, sorry, no, general Yabu Lulime. No, now be acute renal injury, Yamia, general renal function, no, monitor Lulibume. As you do, general Yaba, one study there, 19, general Dapa clean processing, cardiovascular cargo, general renal cargo, Adam COVID, COVID jump, cardiovascular renal cargo, general study Lunia, didn't go my people tola. Do one shit on your Sunday, SGA2, 3 hours value. A tea color, Massimina, Yapipuru, GLP1, GLP1 is sort of Pupiravivo, no, pure and the elements. Otherwise, you lose general design settlement. Tame, severe moderate infection is not Jiluchinjano Jalime. DPP4 in a pattern, DPP4 inflammation county there. Now, DPP4 mass. No, general Middle East respiratory stoma, so here. DPO evidence, Masia Labido, to error, depopulation, Masu, Kagoya on Yote, error, mass and structural gene today, generally SARS COV Male, DPO Tolusi, Povido, Dauma, Kagamu, effect Yanine, so Vito, general, DPO, Pure Jarebo, insulin, insulin, teaching Maro, general, Macauns, you know, step up, intensification insulin, the best way. Emma, insulin requirement may be very high. Nuguna OED without ready, insulin Luda, insulin Luda, insulin dosage in IPR, insulin dosage is so much so high that even you may need to give insulin infusion therapy. Insulin regime or insulin regime Mesura, general according to the Luga guideline or general Dunae safety, efficacy, better organ, as well as care providers, the Kana Lunanet of I do in a video, to follow through Lunanet to test and guideline, general Lubu, Nama Diabetes Association, Endocrine Society Association, we have already developed the guideline, a guideline time, Look at Chijapima, Chinoshima, Pamagia, Chavni Lakami Tomuro, Lurebo, no? Not quite COVID-19 and diabetic care, what are the implications? No? Implications are diabetologists see you do you go to the we should, or the diabetologists should support the inpatient team who are mainly taking responsibility, taking care of the COVID-19 patient through diabetologists here. To be supportive people who may can a main care diabetologists colleagues in the through advice to you. Collaborative care is very important and multidisciplinary care is very important. The role of diabetologists is now a crucial role for those patients with diabetes. And we should also, diabetologists also should educate other healthcare providers as far as the diabetes is concerned. And also the general insulin administration, insulin therapy, monitoring, healthcare providers, non-diabetologists who educate the Lura, and we should, diabetologists should facilitate early discharge. There are three roles here to the diabetologists role at ongoing diabetes care or hand washing, social distancing, health promotion, exercise, mental health support, communication, telecommunication, patient safety, and the staff safety and the timely management. This will lead to the better outcome. There are three aspects: continue regular medication, including ACI, and the 6-day rules, and the seek medical attention early for acute illness. Name also medical attention to the chest pain and more as consult with three main factors for. Transition period, lockdown, transition period, easing of the lockdown, generally in the 4 aspects. I'm a sustained measure, so lockdown, prevention measure is each look at my incremental easing of the fusion lockdown, the fusion, and the movement, population movement, the fusion, short period, protection of the vulnerable people. It's a one essential component in the easing of the COVID management. Vulnerable period, vulnerable people, cardiovascular disease, cancer patient, diabetes patient, tetrable Hiroshima, Nale, tetra anere, you say, you go with the COVID vaccine, can anyhow take you, temperature, dinero, Tanzania, no? General, the exponential growth killer, General, Sarabjere, the overwhelmed. General health capacity to mean like the lockdown load like the exponential growth with the COVID-19 patient in my Chala is R0 are not 1 hour job. We need to take 4 action. General lower lockdown set formula, lower risk activities, general quimula. Allow higher risk activity, fully locked down. Lower risk, so general cafeteria take away the Toloya, what I'm you. Allow higher risk, restaurant, you can put the general cinema, you put the theater, you put the not to go, Johnny, you put not to go, lockdown, lower payment, that's a management company, since I will do. All level, my point are. All level, whether we keep on locked down or whether allow lower risk or they allow the high risk or the fully live lockdown, we should take consideration of management of vulnerable period who are cardiovascular diseases, who are having a diabetes patient, diabetes patient, cancer, other patient. And I'll tell you, since I will do not quite all. When we lock down, now when we have gone through the COVID period, first phase, we have encountered, we have experience with job loss, income loss, poverty, So a lot of social stress, social and psychosocial stress. And the second phase, actually, we are now in the second phase. Again, also poverty risk, loss of gender equality, rising suicide, so on and so forth, several socio-economic factors. And eventually, when we go to the third stage, there will still be some long-term ill effect on the health and the socio-economic. So all the problems, they predispose the persons into stress. That stress can also aggravate the glycemic control, cardiovascular control, and the hypertension. Socio-economic impact all stages even also lockdown period long-term ill effect is she nine so that since so as far as the cardiovascular diseases managed, CVD is managed. AACE recommended that CVD patient all should be protected from the exposure to the SARS COV-2, and they should be educated how to protect themselves. And there should be enough resources. CVD patient resources although elective procedures they are emergency available staff members should be educated to respect barrier. Now staff they take them supposing a patient come to with shock line, shock go, to revive there. I got to always use PPE, protect you first, protect yourself. Shock the lalu say after that without protection, always use PPE, then Pidama shock go, confirm Lumala, confirm Lugula, no shock go, local Lulim. Always start with the PPE, no PPE Lumila shock go, provide Lumen. And the cardiovascular management, we should categorize all the people into emergency care ludla, and without testing, even COVID test no other education, COVID patient over the water, general emergency management people. Urgent patient, lower priority patient, elective period patient, no, whether patient have ischemic heart disease, whether patient have acute or chronic heart failure or arrhythmia, according to that risk category. For example, non-STEMI, no, ACH solution, very high risk, STEMI, lower. General 80 patient regard as COVID patient low at the water PPE will be lower. General high risk, intermediate risk, to a management loader chamber, COVID-2, SARS COV-2, Sepiroma, Apoma, Motivi general management lower. General GB Miazin non-STEMI general 29, non STEMI do Yabiso, not general, saying my dom of Chipare, not saying my dom of Chidor, general primary saying, primary lessons be Lansara, that saying my policy one Mutide, United Chile one Mutide, Adi Chamara, CAPG, CAPG Lumesa, Aguaro, PCI Lobo, those PCI Lobo, Copicolama, recommend look there. General and Yazu chest pain so there. General GBD network, general network, chronic coronary syndrome. Continuation of the medication, it is very important. And follow up to this coronary syndrome, angina she does really work. Bind the telehealth, it is very important. Bind the telehealth, not bind personnel. This is very important. Revascularization, patient must be postponed in the low to intermediate risk patient. Revascularization, she usually postpone low. No, China is postpone low. CD angiogram low. Exercise test they prefer CT angiogram look pure. No, angina arrhythmias, atrial and hypertension. Continue treatment with antihypertensive treatment. No need to adjust medication or stop ACI, ARB. No, COVID also be yellow meow. ACI, ARB, ACI, ARB, Secopania. And continuing monitoring machine chamber or the amount generation Udima La Piare telecommunication system through monitor teacher locally. This is very important, and we need to set up a video or phone consultation with patient if required. Inpatient young drivers, inpatient libero, Sabilo Palima. Error, COVID humanitarian crisis change. General COVID suspicious patient. Migrant workers, migrants, general COVID, general quarantine, community quarantine is loaded chamber. And a loaded chamber, general medical care by period, cannot do junior, general infection to no general Nazi Rado, Chansu Rado, 3 power there, see you dread, see a polyparamshibu. This is the recommendation, international recommendation. No, and there's a general quarantine standard, no medication and related supplies, insulin say. NPH insulin regular 30 some stock and insulin syringe she did glucagon generation no glucose 50% glucose she did glucose tablet she did metformin urabibuso metformin glucoside pressure to lose certain and then the series general emergency kit quarantine center machine she on the glucometer strip ketone strip and urine strip ACE tests are available for Tashi will be no, not to go general management, short term management, general a good Napapo, general quarantine loaded chamber, general priority, no type 1 patient la Sheila, type 1 patient she not do insulin mapiapu, general purely a quarantine patient, not to go diabetic care for vulnerable population, pregnant women, elderly, those with complication of diabetes. Attitude, prioritize to be general Kubulu, general continuous access to essential medication. See what you general Uzapi will and Yejira health center machine, quarantine machine, say I will say Mario, general, diabetes, education people, and guideline general, Peter Lume, long term for no long terms are migrant workers, or to Doga this Gani matter, but Aratara. I got a COVID, short time did which way. General Luzon City of Tara, short time and Luacha, Table, Senzabu, Lulime. And specific measure, patient with diabetes are not patient with diabetes, the patient with diabetes are a Changaja. Good glycemic control is essential. It is cardinal. And the care for the CVD and CKD is very important. And the flu vaccine is very important. And the exercise, regular exercise is also important, and the nutritional care, diabetes specific nutritional care. Now, Ashialos of your children, Tauchin Kesa, Molos of your children, Tauchin Kesa, Dasai, Luaven, Tauta Kesa, not to go out, see you no moon in Tauta Kesa, and I general the detail of Luamen. And generally, hand washing, respiratory hygiene, face mask, avoid non essential travel, social distancing, that general. And who are a Chulubian, mask. Mask is aerosol to be droplet to be Tatia droplet here, long at Jatare, and the aerosol long at Jatare. As John Masia affected to the must touch it. The man must touch it is source contributor. Must, could you like now, master can. Quamadine, do Takan to drop it each other. No, Qua Yoga Miyaji, you know, and there's no such a game, through agent through. Clock must say Takina Tito, the strategy general. Master the case out, general, a linear table. Master be when the calling for Matapo, Medium chamber, Nayama chamber, and Ale, Shauni Shamaria, a TV movement, Shauni Shamari Kurane, Mulupu Lulime. I'm going to conclude because this is the COVID. So I interpret the COVID as a mnemonic for C for comprehensive care, and we should achieve the optimal control. And we should conserve patient virtually. Now we are not virtually discussing it. And those people through severe and moderate intensively controllable. And distancing, social distancing are now new normal. Low jarma, you do less than no set a case. No, Luna, Luna, Chabiro, Niaro, Nijama. Now, General Singama, Luna is on the Tomuji and Lekoma Kaviro. Now, distancing with General Shisha General. So, my interpretation of COVID, COVID is comprehensive care, optimal care, virtual consultation, intensive care, and the distancing. What about 19? 19 the first. Diabetes control, first and foremost, it is very important. It is very important. It is more than ever. It is important more than ever. And then 9, while you are staying at home, there are 9 rules you should stay, number 1. You should drink plenty of water, and you should exercise regularly, and you should use virtual method of socializing. Social distancing, yes, I prefer the word physical distancing. Socially, we should connect it, whereas physically, we should distance. We should not social distance, socially distant otherwise we stretch in a pocket and we can use virtually socially connected I mean virtually connect and avoid excessive negative messaging this is very important. And the last is next one is the stay busy. Coco, Pimia, Imanirachima, Tanamia, Ema intention low me, Ema gardening low me, Tamubo, no cleaning low me, go chilivo, General Imanirachimaro, Palo, the General Piazza Pachete, no General Living and look at the Piatia, totally look at all, no? Eat well, regularly, healthy. Focus on your breathing. Breathing exercise is very important. Breathing mindful breathing. No mindful breathing. Go now when you talk in the winning breathing exercise meditation now we do a chain watch general polareha immediate a Joshi on a sapa mewo. Can a Joshi at Domewo? Doesn't check all coachable. So my interpretation of COVID-19 is now the comprehensive care, optimal care, virtual consultation, intensive care for those necessary, those required, and the social distancing, physical distancing, and diabetic care is first and foremost important, and we should observe 9 rules for stay at home. Having said that, these two websites are my suggested website for the reading. One is from the NIH, NIH recommendation, all the latest news. No, Kurukuin Tamula, Matagula, Janahayo, ibuprofen Tamla, Matagula, everything was to Raima Poro. This is very highly recommendable, and the ESC guideline, the website you can approach for. Having said that, now Alo Sikchana Javaji, Kujama Javaji. May you all blessed with health and prosperity. Thank you very much for your kind attention. Thank you. Now, there's been a few questions on the chatting box. No? We are reluctant to use the SGLT2 inhibitors in COVID era. So what should we do when we cannot get target glucose level? SGLT2 mild to asymptomatic patient and those patients who are eating well, that is how we do about it. COVID moderate to severe, I change out to no jam. General control Magoin balloon. No control Magoin, as you do pay to you. Yeah, do control Magoin, not to know insulin, Aluma, insulin, very recommended about it. Busy insulin patients are also afraid of studying busy unit. See to our amazing Lunaria that tomorrow, Jessicano Mala, Nason tomorrow to Sivela, Nason Bob, Nason, a savior Davilata, Alo Tijarame, Alupia de Jarabo, no? General Nalevare, Tabime, Tidu Kalama, no? COVID Kalama, Tuju, take you, County, Ibinama, Yejire, Go Midali Dole Yejire, Mimi Dole Yejire, no? Tuju, Macaunusi. COVID Yagin, Qua Pubio, Pietana Kanzame, Tibia Monim Yame, Ero, Go Pico, Danny Macan on Siju Gamua, a young Yiji to no, DJ Maro, Sintura Guro, General Tubu Lubare, Insulin Tujini, Mimi Dradamaka, Midali Pipare, Joy Lacamare, Tametano Mianarotia, Nadovia, a Pietara. Jalusia, Asiano, the Imalan is a site at MCU. And Nani that him, I'm a chewy doubt of it. Pocarisa, 100 Dasai doubt no Tijo Numuzara doubt no Glusana, diabetes or Daritauda. Anyhow, you short hangu, General Romia, Shisangaya Duma, General Diet Man, a good posoraging at the Deporachia, the Deporachima, General A. Churaya, Churapado Monia, Churapa, the Dimia, I also don't go where they are Champagne, more than 60 to 80% general PM control Yarabare. And actually, I do Tomama Chowder, so you know, General food drugs of Dorachima, Genoa, Sara, Mepam Beta Vivo, Saffron, Beta Vivo, now, General DP4 in Beta Vivo. General food drugs is being in this, Genoa, Subaro, Ikabusu have you or the moment general, Pioglitano have you general, Tedamu Luji Luva, Pina, general insulin metanol Savulua. Insulin Buluma Miau, Matuna, Vision and General, food drug national, AACE General Tatel Yavale, not go general being in a series optimized. General Peter, a series dose nanny, dose to optimal level young, General Tulu Valime. Now say I tell God. COVID patient here, direct quality diabetes mare, and the platelet down in Joshi Malare. So, COVID patient here, general thrombotic events, coagulatory jump, thrombotic event, stroke the yard, era jump a platelet, and the platelet down in Kamala, media, Nangamale media. Time general the detail, hypercoagulability, general, Pete Chetty Sheet, general, so pro-inflammatory markers the jamdu pro-coagulation factor AACE stimulated with von Willebrand fractures the really repeated. So coagulation cascade abnormal to coagulation so coagulation jamu not platelet aggregation. Antiplatelet without change one expert panel I just aspirin so that thrombotic stroke Kagonanea, but the physiology yard or think of Sangudu, Timare, no? I look at the man, Stromiano, and play that down now, who are hypercoagulable state jump dinner, and he played in the Massangu, Tahu, take Massangu Timare, not Ninganaga, Pinachina, I look at Jabare. Not is it better to give a double antiplatelet? With the CVD during the COVID era, so that's a little bit. Aspirin plus COVID gray education, myocardial infarction, post myocardial infarction, post acute coronary syndrome, pediatric chain, post general thrombolytic post TIA, post general stent head, I chamber, Janet chamber, data who are Puka evidence of machine. Antiplatelet defibrillator, my opinion, personal opinion, antiplatelet is sort of a coagulative state, general Massainu, general platelet aggregation, home mafia, coagulation, stake out, coagulation, extrinsic pathway, intrinsic pathway, there are 8 pathway abnormal pitwara. Factor 8 to T, the von Willebrand fractures, Nabanya cascade the pitwara. Cannot in a Jew plague of a people, now monoplague of a people. Skimming half she did go. Cannot in a cannot to know be was. Not Tiago. Diabetic cardiovascular comorbidity she did. STEMI, non STEMI, acute coronary syndrome, heart failure, which is more severe. How about diabetes with cardiovascular comorbidity? Comorbidity such as diabetes and diabetes, Puvisura, diabetes Kuria Pusure, cardiovascular Kuria Pusure, hypertension Surevo, Era Tukujiano Pusurevo, Era Tunguponeti, Puvira Surevo, Era John Leturia, a Tijara Nyara, a Tijumara CVD, a severity Miarevo, Era Teochia, Kujia, diabetes Kujia, a severity Susire, so hypertension and coronary disease, Puvisure, Turuponeti, Puviro. Through organs, the Korea take a bit of the Puvisura, Toria, Tonguponia, Pusure to study the Tribar. Pangasia Yaro is in a symptomatic asymptomatic patient of Jomla, asymptomatic in asymptomatic COVID-19 type 2, do we need to change diabetes treatment? Asymptomatic to Jore Trajamu, the Basymptom Mishira Jerome Pavare, to a diabetes control county Lucy, diabetes control county, however, some people do it. My to asymptomatic, though the moderate to severe, so we need to change. We might need to change the anti-diabetic treatment from oral to insulin. I mean, asymptomatic general sort of my cases so long as their control is under control, as the glycemic control is under control with the previous drug, I don't think we need to change the drug. moderate severe degree we might need to change the type of treatment. So mainly insulin indicated. How about the long-term sequelae of the new onset diabetes after infection? New onset diabetes there are hyperglycemia in COVID, hyperglycemia, newly hyperglycemia, nakuwa current new onset, new onset diabetes, pre-diabetes diabetes no pre-diabetes because of the COVID infection, SARS COV attacking on the beta cell, damaging the beta cell, so compromising the insulin secretion. They also began hyperglycemia. And beta cell is already damaged. They will be left with insulin dependent, insulin deficient diabetes. Not to call during the COVID period, stress plus pancreatic damage. Stress the counter to insulin resistance. Once the patient beta cell already damaged, they were very likely to need lifelong insulin. Lifelong insulin because they like a secondary diabetes, like a type 1 diabetes, because beta cell is already damaged. So, no, to do I do about it. Not to call long-term sequelae, new onset diabetes after infection, long-term sequelae, now by new onset likely to be secondary diabetes, likely to be act like a type 1 diabetes. In other words, is very likely to require insulin lumen to watch it. Now, say I tell difference between type 1 and type 2 diabetes that depend on presence of insulin in blood or not. Type 1 and type 2 shida kanaguriya insulin took the pancreatic and insulin top in other words, beta cell function beta cell insulin took them insulin low 95% damage to type 1 insulin maternal niva surrogate markers in the C peptide. Fasting C peptide, which are not tiny. Tiny C peptide, machine voodoo, solo ya, the insulin segregation machine voodoo, use and a type 1. Type 2 are allotted time, usually you are insulin resistant on chete, and also contributed by the insulin deficiency. Insulin deficiency due to the beta cell dysfunction. Beta cell dysfunction, not destruction. No, beta cell insulin took one. She does what I'm total. The plus insulin resistant polytype. I'm a Savio type 2 diabetes. But beta cell is still present, function is still present. Era Jamu General, beta cell function, she did insulin trial, insulin secreted to cause it. Suffering urea, general GLP-1, general sort of DPP-40, general PV, insulin trial, Lulu. This is type 2. Type 1 markers are absence of insulin secretion plus autoantibody. Autoantibodies are, either say antibody web GAD antibody web glutamate acid decarbolase antibody web insulin antibody don't go. No, not antibodies is Sheila. Type 1 and type 2 is different between type 1 and type 2 depend on the presence of insulin blood or not. Now, insulin cheating. Kanagurema, insulin sheet machine, pancreas are told pancreas insulin machine. Insulin sheet machine, insulin general direct time. Insulin batones or tabular, pancreas are tabular, liver, lungs at the chamber, metabolite, blood machine have tote, no done, toy, you sign. Tabi see peptide or general pancreas are told like be the pancreas, liver, lungs, circulation at the what to like that time machine, but peer penny machine, metabolize blue by lunar here to adjunct no see perfect tiny pit. And in the same type 2, hyperglycemia is due to insulin resistant, even in the presence of hyperinsulinemia. Insulin resistant are insulin anything chadore. Chadore beta cell to action or she needed. Action she needed insulin anything your ma insulin your insulin compensate looked at Can insulin glucose so what a numuna glucose 10 milligram insulin 1 unit to our so I can jalo insulin resistant in the jamlu no to our insulin resistant in the anything insulin total nyale so 10 milligram of China no and as we sort of 5 milligram of a jarabo and as to do a nasa to be no pay and as 2 milligram to be ma insulin 2 unit to be ma so 10 milligram jam so that insulin hyper compensatory need insulin pubi took the insulin resistant state ma asabima hyperinsulinemia association change. In the same type hyperglycemia is due to insulin resistance, even in the presence of hyperinsulinemia. Why do we test blood insulin level? Insulin level insulin blood insulin level pancreatic secretion would direct reflect loaded job. Bajam is to a Portavania liver pure apopia, lungs to chapter 25 to 50% metabolize the job. Peripheral insulin does not closely reflect the insulin secretory capacity of the beta cell. Whereas in case of C-peptide, which is not metabolized during the circulation and the systemic circulation, therefore it reflects the accurate secretory capacity of the beta cell. That's why we prefer C-peptide to the insulin. I just see you C-peptide B cell time. C-peptide ka aguna bain chano dairy male chano di lab ji de ya chano sample ri phit do tai je mji ba u sia taw kana la ba shi ba le tai lo ya ba C-peptide ka. Now monomer sia yi la mo sia yi myo. How a GP can work from home to take care of diabetes patient. Generally, stay at home or W work from home or WFH or WFH will be a chamber. Lulu Mia, hair care provider is a people. Hair care provider is a hair care provider. Do not gene as you look at Siamuni. By the Russia, Lamachi Lumia, Edlu, Siamne to Siamali. Now, pharmacist, Jane, Tangielo, my same mother, now food delivery, loaded. Now, General Janet Lungu, or General Police, now we are General Fireworkers, Bluma work from home chilling. That means general practitioner as well, general practitioner, so you know, General good name, telemedicine, Kabama or Pumama, General Abiba, telemedicine, contact the patient with insulin with the telephone. I'm general too, so you know, two software is cheaper. That means general take your computer illiterate mode on I think you join in that software thing looking near Viber never general set of even Viber or Madurua, Ludaya, Masetter, and Tadini to be actually. Anyway, General Imani Vida, COVID Kalama, General GP Weber, I will lunarize General from home to take care of diabetes patient, the pressure general Tidu Yame. Through symptom general Tidu Yame, through concern, complaint of general Tidu Yame, through blood glucose general Tidu Yama, Poppy general GPMPO, through town in the city BMP, era through you return to Pajam Tenile, general, through a diet with check Lulu Yarabo, through a physical agree with check Lulu Yarabo. There we can advise them accordingly. Takuaro, we cannot examine them personally. Personally, the Sanumia. Online in a general through something is better than nothing. Now, really thank for the precious lecture about diabetes. I would like to ask 3 questions. First question, vidagliptin can also be used in diabetes patients during COVID. Vidagliptin, sitagliptin, linagliptin, these all 3 were general DPO inhibitors DPO inhibitors here, shifted there, don't know now DPO inhibitors here, DPO receptor mass Middle East respiratory distress syndrome, Middle East mass the SARS COV COVID to a coronavirus to a receptor ACE2 inhibitors in Macau, A2 receptor in Macau, to our DPO inhibitors Malapaviro, to a people Shibare. Era DPO inhibitors of Tonosi, SARS or sort of a mass virus lavido reset of a pound as to serum when say replicate blue name as a to a popular of the or did we who are the party situated don't name not who are almost into a popular anti-inflammatory effect the yanine not who are sort of virus entry into the cell carbonated and to a popular beneficial effect yanine. Beta-glucan is one of the inhibitors available in our country. The final question is, which is the drug treatment of choice in the diabetic patient with metformin uncontrolled during COVID-19 period? Metformin don't be that. Metformin beta control me out solution. Whether COVID period, general. Next step are Naku was the DB with a tap on policy to supplement you. Patient control me out, General Chure Yiri, Chure Moni, Chure Titi, Dawe, I don't go in check the bow, no money downilla, no creamery barret, COVID General, the coffee mix it down the lad, tea mix it down the la, see you no money, Ashi on the down the la, Tasadu the down the la, the deal is on the la. No, I am beautiful. Children money is anila. I must have many meponym out general COVID period cheto, Nyale, patient to sun in the town and general supplement you take or do another blood glucose. I think we also know general DB inhibitors, general terrible. And meponym, sort of chini resurrevo, COVID chine, moderate to severe infection, COVID chine, elamusuino. Metformin is already pepper insulin general the rose color, acute colors by insulin people. This is the current guideline. About that question, what is the advantages and disadvantages that we need to know by using DBO inhibitor as to join the treatment of diabetic patient? DBO inhibitors are the dimension GLP-1 GLP-1 suraga no GLP-1s are incretin hormone today. Incretin hormone and counter to a you can go there insulin cut outlet look there, glucagon on the darby there, Peter sapi glucose gastric emptying will to a delay look there. The salad with a chechen, general moment to Lina Ijama, gastric emptying and complicated chamber. The diabetic patient with gastric emptying general Miani daddy. I don't salad and Sanian, you mean a young paramu, or checking out glucose are checking absorption, checking me a tetra. And a glucose emptying on any delay legacy, sort of glucose rate or rise of diabetes, glucose will let Tatazi 9. And a gastric emptying or delay within not to a certain nervous system, to be more evidence, the sort of GLP-1 is the symbol. The satiety, what means have your tinting Dora, Gina Dora, tinting Dora. Agile Sarah did GP 1000 general GP 2 general which orders Masara was such a thing. TB inhibitors advantage or to a GP 1 tolerate no minican dominate dodema canagorema because of the DB the enzymes is job not Pietwara. A DB enzyme top like DB inhibitors, sitaglipin, beta-glipin, general sort Lina glipin, Pilarity, no, Canagorias, tolerate, no, me-related, increased GLP, no, GLP tolerate, a GLP, checking to the checking Macheto, TB who are related to a two action, sunlight candor, Masalina candor, Candore, to get action of GLP-1 action about GLP-1, you sort of gastric emptying your satiety, insulin, tratao, need a bit of glucagon, tratao. Insulin will trust it at glucagon, Nisi level, no? Advantages that are available. Error DBV disadvantage of your value, the GI cycle is in about, no? And the chupurali, and the gastric, nenary indigestion, and I'm using about. The other cycle I think it about. I mean, notable are about less to a tragedy. Literature, a tragedy Punyana to it. A good Abama diabetic patient was shared by General Tribune, Cairo arthropathy, let the town here, was scleroderma, let the town here, let the town here, General Lenku, send to the literature, Matiro, Matiro, Benedict, Queen, General Priya sign for a while, General Wama, the Webama Lego, Chile, Lepuane, Material, Lepua, Coney, Tibet top sign for a while. Cairo authority, Arthritis, and I pit out to no poop to level. Jana pancreatitis piteru, medullary carcinoma piteru, and I am hoping to go through study the yard. SEA do what? SEA do a disadvantage, advantages are about it. It is very effective. The effective advantage are about it. Cardiovascular, even 39% of, if I remember correctly, so 39% of cardiovascular or and also renewal 32% no renewal accounts so advantage of the cardiovascular protection and the renal protection. Disadvantages are actually to urinary infection and mycotic infection, genital tract infection in the yada. Now to go out some report can actually process some report lower limb amputation is a fit. I mean, now studies is lower limb amputation at time to do that. Diabetic population, no? So, Adika UTI, general, UTI, general, Corona Twitter Pale, Janaro, Tibiro, G, Cypher, Mishiba. Not quite a general data were euglycemic diabetic ketoacidosis for the blood glucose level, normal ketone 10, acidosis, euglycemic TK, percentage object of death on Yale, see them at home of Japan, as you do not pattern. That's no say a meter a question, Pibida Pimelu, you sabber. A meter as she did. General Tonai, Tanaile, and Tonaila Quebi, no? Tonai Quebi, change maybe not on that Siamiao, Alon Chidu de Mare, no? Alon Chidu de Mare, Cherry go by Jama, no? Tanai Gola Genonet to see that Alon Chidu de Mare. To be generated to keep on just Yamiao, that Dorinia, the Niga Mega, Matango, Yanni, Bema Lematoa, Vene, so we don't know. Yanni, you enjoyed it. I miss you all, and not well. I don't think my way, stay home, working safely, stay safely with the family. Kubikalaba Macauna, Paluda Macau, moving near look at it, Pekuna. Stay at home to Midadina Puvinara, a chain puri Puyala, at a good Jushime Piatia, no Badadia, Pada the Gavage, Chana, Puvisa Pabuchin Yala, no Midadi Puvi chain Pina, no? Jama Asia, Puvido, Dr. Yala, Charu, webinar with Nusapare, Alo Chidutimare, Alo, Jama Chana Gane, Kubwa. We do a Joshi do Lungan Samramia, maybe Midadi do a Joshi de Jubuna, Ludamia, Na Gavadu, we a Taiwan, what time you do a Jubuna do Ludamia, and not so no Piana, Ludata Gumbre, no Ludata Yellow do a Jubuna do Ludamia, to be a Junat as I legit be my so I legit another time in your pay or more. Look down and lose on the Ludamia Pija Baji, Alo Kubi, and the Annie, Miando, be any occasions on it. Jolan Java, Jidu General, Sanabi Vale, Alo Nusa Vale, Jidu Temare. Now, Mega Light Triangle, the webinar female on significant to it, now Mr. Gubin, Yumi, Jane, Mega Life Science, when I'm Alo, no? Alo, which are not in it. Jidu Temare, if you're in the Nikucho Vale. Thank you very much.